Pramlintide is an amylin analog used in the treatment of diabetes. The weather's so nice out, so let's walk and talk along this promenade as I share my visual mnemonic with you to make for clear skies on test day. It's hard studying all day, so just relax on this promenade stroll. By the way, a promenade is our symbol for pramlintide, a drug used to treat type 1 and type 2 diabetes. It's the pramlintide promenade. Get it? Its suffix lintide is actually short for amylin peptide because pramlintide is an amylin analog. We'll cover what this means next. Why is there an ambulance on this promenade? Oh, must be for that poor man who looks to have contracted a bad case of food poisoning. We'll come back to him later, but for now, turn your attention to this ambulance. Hey, did you notice this ambulance is actually labeled amylin? That's because this ambulance is our symbol for amylin. As we mentioned, pramlintide is an amylin analog, meaning it works similarly to the amylin produced by our own bodies. So what is amylin anyways? Amylin is a peptide hormone secreted with insulin from pancreatic beta cells. Amylin augments the effects of insulin, the specifics of which we'll talk about next. This amylin ambulance is in the way of the food stall, slowing orders to a trickle and delaying the clearing of the people in line. This delayed emptying of the lunch rush should help remind you of the delay in gastric emptying caused by amylin. This delay helps regulate postprandial glucose levels and prevent glucose level spikes. Pramlintide is a desirable diabetes drug because it promotes satiety and thus can help with weight loss. Now let's move on to the other side of the food stand to cover the last major effect of amylin you should know. The workers at the stand are so stressed by this situation that one of them has even dropped the guac. By the way, this falling guac is our symbol for decreased postprandial glucagon, another effect of amylin. Get it? It's the glucagon guac. Released from pancreatic alpha cells, glucagon increases glucose levels in the blood, making it the main hormone that counteracts insulin. Since amylin and pramlintide decrease glucagon levels, they decrease glucose levels and help insulin work. This, by the way, is the whole goal of diabetes medications. Now let's get back to that sick man that the amylin ambulance came for in the first place. He's still looking pretty nauseated, and that hand on his stomach, that spells GI upset, which is sure to lead to diarrhea later. This guy's upset stomach should remind you of nausea and diarrhea, the main GI side effects of pramlintide. Hopefully the paramedics can help him out. Wow, this promenade stroll turned out not to be so relaxing. I could really use a margarita from the food stand. These stall employees sure have butterfingers. First the guac, and now the sugar too? Let this falling sugar remind you of the adverse effect of hypoglycemia, or low blood sugar. On its own, pramlintide does not cause hypoglycemia. However, since pramlintide slows and reduces the glucose peak after eating, a poorly timed dose of short-acting insulin can drop blood glucose levels before they've had a chance to rise. This can then result in hypoglycemia. Thus, in patients starting pramlintide, consider reducing their insulin dose while adjusting the dose of pramlintide to avoid hypoglycemia. Bummer, I didn't get to grab a drink. Let's recap and go grab a drink somewhere else. All this blood sugar lowering talk is making me crave some sugar. Pramlintide is an amylin analog used in the treatment of type 1 and type 2 diabetes. Pramlintide is an artificial form of amylin, a hormone that usually works to reduce blood glucose levels by delaying gastric emptying, reducing glucagon levels, and promoting satiety. Side effects of pramlintide include GI upset with nausea and diarrhea, as well as increasing the risk of hypoglycemia when taken with other diabetic medications. All right, I think my drink is ready. I'll see you next time.